that temperature is the problem, and we know that temperature can be caused by bacterial infection, can cause high temperature. And how do we know that there is high temperature? We can know that there is high temperature by looking at the reading of the thermometer. You see maybe 38 degrees, 39, 40. That is the evidence. I take another example. When we talk of vomiting, it means there is a fluid deficit, right? Are we there? When we talk of vomiting, it means there is fluid deficit. So we write fluid deficit as an assessment. Fluid deficit. Fluid deficit is already a problem because of vomiting, right? Now, what can cause? We already have this problem, which is fluid deficit. Now we are left with cause and signs and symptoms. According to you, what can cause fluid deficit? Vomiting, that's good. Are we there? Fluid deficit related to vomiting, evidenced by what? What are the signs and symptoms that a patient is vomiting? What shows that a patient has vomited? Painless, because when you vomit, we become pale. So it's a fluid deficit related to vomiting, evidenced by pale skin. Are we there? That is a nursing diagnosis that you have pointed out. So your problem here with the nursing diagnosis is always to know what can cause and what are the signs and symptoms of the problem. Because if you take diarrhea will lead to fluid deficit. So you can say fluid deficit related to diarrhea, evidenced by pale skin. Okay, you take one of them, you try and let's see. Chest pain. And in any exam, when they ask you of cardiovascular diseases and which one is a priority, it is chest pain. If you see chest pain, take the answer. And in any exam regarding nursing processes, if you see assessment, you take is the answer. Are we there? Yes. Good. Chest pain. Read out the nursing diagnosis.
Chest pain related to.
You already know the problem. The problem is chest pain. What can cause chest pain? Ask yourself, what can cause chest pain?
Pain related to pneumonia.
Chest pain related to pneumonia. When you have pneumonia, do you have chest pain?
Cough.
Should be cough, right?
Yes, chest pain related to. But I thought that would be as evidence to cough because the patient is coughing.
We have chest pain. That one should be for cough. When we talk of chest pain, it is a cardiovascular problem. It is not a respiratory problem. Are we there? So when we talk of chest pain, what can cause chest pain? Chest pain related to cough. Because there are coughs that are non-productive. When you cough, you feel the pain here. Accept. So say chest pain related to cough. How do we know that? What are the signs and symptoms? Chest pain related to cough, evidenced by what?
Difficulty in breathing.
Evidenced by?
Difficulty in breathing.
Evidenced by difficulties in breathing. Is still correct. Evidenced by difficulties in breathing.
So can you say evidence by, is it dyspnea?
Dyspnea. You can still say dyspnea, but if it was a chest pain related to cardiovascular diseases such as hypertension, evidenced by dyspnea, because when you have chest pain due to cardiovascular diseases, you discover that you cannot breathe well. So when the heart is failing. Have we understood? Should we take another example? Okay, good. Pale conjunctiva is a problem. Pale conjunctiva is a problem. What can cause your conjunctiva to be pale? You see, the doctor always check like this. Check. The doctor is looking for what? Looking for blood level. So we say pale conjunctiva related to low blood level, evidenced by what? Still evident by pale skin, because when you discover that when you don't have blood, you are pale. We can say pale conjunctiva related to anemia, evidenced by low HP. Are we there? You are just accepting. Well, I say take one again. It's a problem. But the most important thing is for you to know the concept. I believe at this point, when you get back to the house, you can do over and over. And we are always there in case of any mistake, we'll correct you. Are we there? Good. Now, we already have the nursing diagnosis. The next should be what? Planning, right? The next should be planning. Like for example, we first of all took temperature. So temperature related to what? What can cause high temperature? Bacterial infection. Evidence by what? The reading on the thermometer. Now, this is the nursing diagnosis. The next is what? Planning or objective. What can be your planning or what can be your objective according to you for this? The problem is your objective is you should always quantify your objective. So your objective will be in 1 minute let the temperature be down. Are we there? So your objective will be in 1 minute let the temperature be down. Are we there? That's your objective. Now the next is what will you do so that this temperature be down? What will you do so that the temperature be down? Don't administer. Nurses deal with known pharmacological. Are we there? If you want to say administer, it will be maybe the last point, and you say administer as prescribed. Are we there? Yes. So we in 1 minute let the temperature be down. Intervention. You can open the doors and windows. You can tape sponge. You can reduce clothing. Are we there? You discover when you do like that, the temperature will fall. Then you can say lastly, you can prescribe. You can give medication as prescribed. Whenever you say you give first, you give as prescribed, maybe the last point. Are we there? Because nurses deal with non-pharmacological methods. Now, what is the rationale now? Why were you opening the doors? Why were you reducing clothing?
for exchange of temperature.
You were reducing clothing, sponging to bring down the temperature. That's the rationale. The next is evaluation. What are you evaluating?
If the temperature went down in 1 minute.
In 1 minute, that's good. You are evaluating to see if your objective have been made. So you are evaluating to see that in this 1 minute is the temperature
Down.
That's your evaluation. And if you evaluate and you see that in this 1 minute the temperature is not down, you go back and reassess. Are we there? Is there any question?
Understood the rationale.
The rationale. Okay. The rationale is we know that the patient was having a high temperature. You have intervene. When someone is having high temperature, what will you do to reduce the temperature?
Remove the clothing.
You reduce clothing, you open the doors and window, you take the sponge, right? What you are doing is to reduce the
Temperature.
your rationale is why were you reducing the clothes? Why were you reducing? To bring down the temperature, right? That is the rationale. Are we there? Hmm?
Yes, sir.
Okay, if we are there, this is when a patient is in front of you to bring out the needs of that patient. But now in your HND, they will usually ask you, they can bring back a pathology. Then they say draw a nursing care plan of that pathology. Means what they are going to do is they will assess, they already assess and bring you back a medical pathology that a nurse will draw a nursing care plan for a medical pathology. Are we there? For example, medical pathology, you have asthma. Are we there? Asthma is a medical pathology, right? They can ask you to draw a nursing care plan of asthma. What are you going to do? Who can try? Who can try?
You start by assessing the patient.
Hmm?
You start by assessing the patient.
You are not assessing any patient again. They have already assessed and they brought you the problem that the patient is having asthma.
Asthma.
We should understand it. Are we there? But the other part that we did, you were the person that assessed to bring the problem. But now the examiner have assessed and bring you a medical pathology. Now they're asking you to draw a nursing care plan. You are not supposed to assess again. They have already done the assessment part for you, and they discovered that they brought asthma after the assessment. Now they're telling you that the patient is having asthma. You should draw a nursing care plan for that patient. Is it understood? Should I take it all over again?
It's understood, sir. It's understood.
Okay. Because this is where now the problem is coming. Good. First of all, what is asthma? At least let's help for maybe case study. What is asthma? Asthma is a pathology of which system?
Respiration.
Respiratory system. And a respiratory system is made up, it's divided into the upper and the lower respiratory tract. Now, if they ask you which components make up the upper respiratory tract, which components make up the upper respiratory tract?
You have the pharynx.
Good. What I'm asking you are just HND questions I'm asking you. What make up the upper respiratory tract? let's just do a rundown of the respiratory system before continuing. What make up the upper respiratory tract? The pharynx, accept with you. The larynx.
So shouldn't they call in order or?
No, don't go in order.
The diaphragm.
The diaphragm is down. The larynx, the pharynx, and
Okay,
the pharynx.
please take note. If they ask you on the upper respiratory tract, these are the upper respiratory tract. What do we have? What do we have? The nose. Are we there? These are the upper respiratory tract. We have the nose. What are the functions of the nose? To
respirate.
to breathe. Now, look at the anatomy of the nose. The nose is divided into two nostrils. What divides the nose into two nostrils? The nasal septum. The nasal septum divides the nose into two nostrils. Inside the two nostrils, we have small hairs inside, which we call cilia. The function of these small hairs, it helps to trap dust particles, it humidifies, and it warms, it humidifies, and send it to the lungs. Are we there? Because you can ask what are the functions of the nose. It helps to trap dust particles, humidify, and send to the pharynx. Are we there? So we have the nose. The nose again also functions as an organ of smell because it contains the olfactory cells. The second is the pharynx. The pharynx is a muscular tube which is divided into three. We have the nasopharynx, the oropharynx, and what? And the laryngopharynx. So we have the naso, the oro, and the laryngopharynx. So this one I'm also preparing people for the basic sciences because the basic sciences is made up of how many components? What are you supposed to read concerning basic sciences? Anatomy and physiology. What again?
Pathology.
No. Anatomy and physiology, pharmacology, biochemistry, human nutrition, and basic lab techniques make up the basic sciences. And basic sciences is almost credit 9. You should be very careful with that course. Are we there? Now, the nasopharynx. What is the function of the nasopharynx?
It prevents friction.
It prevents. The nasopharynx have two functions. The very function is it is being attached behind the ear, or it is being attached to what we call the eustachian tube. People have done ENT, right? It's being attached to the eustachian tube. It is here that microorganisms are sent to deposit themselves into the middle ear. and causes what we call otitis media. Then the other function is passage of food. Food passes before getting into the esophagus through here. Then the oropharynx. On top of the oropharynx, we have what we call the palatine tonsils, which help to indicate the presence of infection. Then the laryngopharynx is the narrowest portion of the pharynx.
So,
Yes.
during the practical exams, are question papers given for?
They are not giving question papers, but there are moments that they can just see you and ask you oral questions. They are not question papers. They can just ask you oral questions, like what are bed sores? What are bed sores?
These sorts are the presence of edema in the skin.
Bed sores are injury to the skin, mostly on body prominent areas. Are we there? These are injury to the skin that comes as a result of prolonged pressure on body prominent areas. And what are some of the body prominent areas? The back, the buttocks, the scapula, the coccyx, etc., etc. So we are saying that bed sores is going to come when you skip for some time, quite a long time, or when they mount more pressure at bony prominent areas. That is why when a patient stays too long in the hospital, the patient can develop bed sores. Because of too much pressure on these bony prominent areas, it will cause bed sores. According to you, how can we prevent bed sores?
By telling the patient regularly every after 2 hours.
Every after 2 hours, one. The next?
Massaging.
By?
Massaging.
You need to fix the bed to avoid wrinkles. You need to provide comfort to that patient by removing all dirt on top of the bed sheets. Those are ways to prevent bed sores. Normally, bed sores are being prevented by what we call the Braden scale. What are the components that make up the Braden scale? Braden scale is a scale that helps for you, health personnel, to know the risks of bed sore for a patient. Are we there? You write it down. So the next is the larynx. We'll talk now of the lower. We talk of the trachea. We talk of the lungs. Are we there? The trachea, the lungs, maybe the bronchus, the alveoli. Those are the lower parts. So the lower parts, the lungs, the trachea, bronchus, alveoli, etc., etc. Now, what are the pathologies of the respiratory system? What are the pathologies of the respiratory system? The first one is asthma. What is asthma?
Difficulty in breathing as a result of either an infection.
Difficulties in breathing as a result of narrowing or closure of the airways. Good. Are we there? The difficulties in breathing that comes as a result of the narrow or closure of the airways. Now, they can ask you in your case study, you receive a 35-year-old man in the medical surgical unit. This man is suffering from dyspnea and wheezing. What is the diagnosis of this patient? The patient is suffering from dyspnea and wheezing, what is the diagnosis of this patient? Don't forget, I'm going to write some pathologies of the respiratory system, and whatever you see, give the potential or the cardinal signs that when you see, you should know that is that pathology. So, bronchitis. 3, emphysema. 4, pneumothorax. 5, tension pneumothorax. 6, pulmonary tuberculosis. etc. Good. The cardinal sign of asthma is wheezing. Are we there? The cardinal sign of asthma is wheezing. So in any case, they ask you for a case study question and you discover that there is wheezing, the answer is asthma. Bronchitis. What is bronchitis? It is a closure or the narrowing of the bronchus. Are we there? It is the closure or narrowing of the bronchus. The cardinal sign of bronchitis, it is gray sputum, gray sputum. Gray sputum. What is sputum? What is sputum? Sputum is what you cough. Cough. What comes, I will call it the sputum. So we are saying that a person that is having bronchitis, when the person coughs, the color is gray. Are we there? Now, emphysema. What's emphysema? It is the destruction of the alveoli. Since the alveoli have been destroyed, it reduces the level of gaseous exchange. That's emphysema. Now, what is the cardinal sign of emphysema? The cardinal sign of emphysema is barrel chest. Barrel. What is the meaning of barrel chest? The chest become round. The chest is round because the patient is using up the associated muscles to breathe since the alveoli have been destroyed. Are we there? So if you are using associated muscles to breathe, it makes the chest now to be round. That's what we call it barrel. What is pneumothorax? Pneumothorax is simply the accumulation of air in the pleural space. What is tension pneumothorax? It's a question that came which year? Students were very, very confused. It was 2023 or 2024. You're asking of pneumothorax, tension pneumothorax. What's tension pneumothorax? Tension pneumothorax is a situation where there is accumulation of air and this air cannot go out. Since the air cannot go out, it is being mounted on the lungs, which now causes collapse of the lungs. Are we there? It is accumulation of air in the lungs, which cannot go out, and it mounts on the lungs, which causes the lungs to collapse. In medical terms, what is collapse of the lungs? What is collapse of the lungs? When they say the lungs have collapsed, we call it what? Atelectasis. Atelectasis means collapse of the lungs. Atelectasis. What is tuberculosis?
Infection is it a bronchi?
The lungs.
The lung.
Inflammation of the lungs, we call it tuberculosis. What is the differential diagnosis of tuberculosis? First of all, what is the meaning of differential diagnosis? What is the meaning of differential diagnosis? Differential diagnosis simply means different pathologies that have the same signs and symptoms. Are we there? Now, what is the differential diagnosis of tuberculosis?
Please take it over and be different.
Different pathologies that have the same signs and symptoms.
So what is the cardinal sign of pneumothorax?
The cardinal sign of pneumothorax is the dyspnea, and this dyspnea, they feel unable to breathe because of the presence of the air. So the differential diagnosis of tuberculosis is HIV. So when somebody comes to the hospital, I discover that this patient is having tuberculosis, or therefore HIV positive. What is the differential diagnosis of macrosoma? What is macrosoma? What is macrosoma? Because you can get to the maternity and the ask of macrosoma. What is macrosoma? What is macrosoma? Macrosoma simply means big baby. Are we there? Macrosoma means big baby. Of, according to American Society of Gynecologists, it should be 4.5 and the weight of 4.5 and above. So macrosoma means big baby. So when you are in the ANC and you are with a client, ANC, antenatal care, and you discover that there is what we call gestational diabetes. What's gestational diabetes? Gestational diabetes is a diabetes that you acquire when you are pregnant. Are we there? It is a diabetes that you acquire when you are pregnant. And the differential diagnosis of gestational diabetes is macrosoma. So when you are at the ANC and you discover that somebody is having gestational diabetes, that person must be having a very big baby. You need to start programming that patient, maybe for CS. Are we there? Now let's come back. Let's come back. said, if a medical diagnosis has been given for you to draw a nursing care plan, it means they have already done the assessment for you and they brought a pathology like asthma. Before that, what are the causes of asthma? What can cause asthma according to you? Because if they can send you inside the ward and discover that the patient is having asthma, they just ask you, please madam, can you give us 3 causes of asthma? That's all about your question. You cannot answer, it's a problem.
Blood pressure.
Causes of asthma. What can cause asthma? We define asthma as the closure or the narrowing of the airways. What can cause the closure or the narrowing of the airways?
It can be bacterial infection, it can be increase in blood pressure.
I'm going to give you a mnemonic that you will never forget concerning the causes. We'll just put down the word asthma. Are we there? So if they ask you the causes of asthma, put down this. Put down the word asthma. A stands for allergens. Allergens can cause asthma. Is it true?
Yes, sir.
Allergen can cause asthma. The next is S stands for sport and smoking can cause asthma. Sport, smoking can cause asthma. Are we there? The next is T stands for temperature. That is why people that leave Bamenda come to Douala. Bamenda is cool, you come to Douala, you can develop asthma because of the temperature. You leave Douala to Bamenda, you can develop asthma because you live somewhere that was hot, somewhere that was cool, you develop asthma. Temperature. H stands for hazards because asthma. M stands for microbes, as we're talking about bacteria, microbes. A stands for anxiety, can cause asthma. What is anxiety? According to psychiatric medicine, what is anxiety? Is anxiety a neurotic disorder or a psychotic disorder? Is anxiety a neurotic or a psychotic disorder?
It's a neurotic.
It should be a neurotic disorder. Anxiety is a neurotic disorder. Anxiety is a neurotic disorder that involves the fear of the unknown. Are we there? You get anxiety when you are afraid of something that you don't know. And we have types of anxiety. The very first type is signal anxiety, that you have fear for an oncoming event. Like maybe as you are preparing for your practicals, some of you already have fear. The type of fear that you are having is what we call signal anxiety. They will probably have anxiety threats. And the last type is anxiety states. Those are the types of anxiety. Good. Now, we are back here. They have given us a medical pathology to draw down the nursing care plan. What are we supposed to do? Who knows? What you are supposed to do, you use the 14 lead of vaginal handling to draw it. nursing care plan. Because you are not assessing to know your needs. They have already assessed and they give you asthma. Are we there? They have already assessed and they have given you asthma. Now, since we have asthma, what can be the nursing diagnosis? Since we have asthma, following the 14 need of vaginal handism, what's the first need? What's the first need according to vaginal handism? The first need is what? The first need according to vaginal handism is what? Because when they give you like this, is to frustrate you. When they give like this, is to frustrate you, because we know that nursing does not deal with medical diagnosis, but they have given you a medical diagnosis. Since they have given you a medical diagnosis, you must do your own assessment on this asthma. And to do your own assessment on this asthma, you use the 14 need of vaginal handism. And we define asthma as a situation of narrowing or total closure of the airways. The first need of vaginal handism is to breathe normally. Are we there? The first thing is to breathe normally. So in our assessment, we put difficulties to breathe normally. Are we there? Difficulties to breathe normally. Have you understood?
Yes.
Are you taking all over? Have you understood? Okay. Assessment, difficulties to breathe normally. The next should be nursing diagnosis. Nursing diagnosis. What can be the nursing diagnosis? What can be the nursing diagnosis? You are no more talking of asthma again. Are we there? They have given you asthma. Since they have given you asthma, you need to assess as a nurse. And to assess as a nurse, you use a 14 need of vaginal handism, which the first need is saying that breathe normally. Since it is asthma, which we define asthma as a situation of narrowing or total closure of the airways, it means there must be difficulties to breathe normally. Because the first need of vaginal handism is to breathe normally. Since it is asthma, the patient will not breathe normally. Are we there? So there needs to be difficulties to breathe normally. What can be now the nursing diagnosis? We know that the nursing diagnosis is made up of the problem, the cause, and this. We already have the problem. Difficulties to breathe normally. Now, what can cause somebody to have difficulties in breathing?
Can be allergies.
Can be allergy. We have seen the cause as I'm giving. I know why I give that cause. So we say difficulties to breathe normally related to allergens evidenced by what? How do we know that somebody is having asthma? What is the cardinal sign that I told you? I said the cardinal sign of asthma is wheezing. That's what I said. So we said difficulties to breathe normally related to allergy evidenced by
Wheezing.
evidenced by wheezing. Is that clear?
Yes, sir.
So, should I give another example? You do it.
Yes, sir.
If you master all you are saying, you are not going to have a problem on that day. The next will have fracture. People should do for fracture. Let's see.